Timer right here by Russell. He's just trying to blast this into the net.
Oh,
you can see.
I can feel that. Painful fractures, faces that will never be the same, and dare I say, ruptured nether regions. Holy cow. Today we're back at it reacting to all of the possible career-ending medical scenes and intense injuries from hockey. Let's dive right in.
Backhand centering pass. Cassian. Russell lets it go. Blocked.
Oh, he's down.
That looks like it is Blake Wheeler who is hurt.
Right in the groin.
My groin!
Couple things to talk about. Do you wear a cup during these sports? I think a lot of people think professional soccer players wear a cup when they play soccer, but they don't. For all you hockey fanatics out there, do people typically wear a cup or not? Let me know in the comments.
And he is unable to get up. Yeah, he's in a lot of pain.
Oh, a lot of pain.
That blast by Russell catches him and looks like in the hand.
I believe Mr. Wheeler ended up having a ruptured testicle. The testicle, you have two of them.
I've got two.
The structure around it can rupture open, called the tunica albuginea.
Timer right here by Russell. He's just trying to blast this into the net.
Oh,
You can see.
I can feel that. A cup is a hard piece of plastic, pretty much a polymer. You could potentially still break it with a hockey puck. What the heck do you do? Elevate it. The pressure of it just dangling there is going to cause more pain. You can put ice on the area, and if the pain is horrible, call 911 or get to the emergency department so we can take a look.
Wasn't a hit for Tavares, knocked down by Sherratt, and Tavares is hurt.
He got kicked right in the face by Perry, unintentional.
Oh.
But he fell down, and boy, he got hit really bad.
Down on the ground, almost looks like in a tense position. Somebody passes out and has a concussion or has quick traumatic brain injury. You can have this like stagnant motion. Doesn't necessarily mean it's a seizure.
So John Tavares getting attention here, and so not the hit by Sherratt, but a chain reaction.
The trainer's actually doing a good job trying to stabilize his neck to get him to stand up or roll over and make sure his neck is okay. The issue is he had a concussive event to where he has no strength in his body. Oh,
The hit was right to the head. Oh boy, that was
he's out. What's the standard protocol? What do you do in these scenarios? Somebody's lost consciousness, has horrible headache, intractable vomiting, altered. You need to get to the hospital and get a picture of your brain and make sure you're okay. That amount of force can cause bleeding. You want to make sure that there's no swelling. Oh. Hard to know what bone is broken in this scene. It's a rotatory injury, so there could be a spiral fracture of the tibia. There could be a Mason-Nooth fracture of your fibula. There could be regular spiral fracture of the fibula as well.
Well, Orpik, you can see the head down quickly for Polak trying to get a rolling puck settled down. And as he caught back, right knee on right knee. And then when he landed,
He ended up having a fibular fracture. So you have the tibia and the fibula. The fibula is there for structural support versus the tibia is actually a weight-bearing support for the body.
There, but you saw it on the one before. I just hate seeing these kind of plays as right there. The right leg gets caught
Snap,
underneath.
crackle,
That's an
pop.
ankle.
You can actually walk on a fibular fracture. It does hurt. Depending on who you are, depending on what you do for a living, sometimes these will be repaired and sometimes they're not. Depends where the fracture is. Sometimes you might need a small plate there. Out cold. Nose would be the most common area for blunt trauma to the face. You can have a laceration to the bridge of the nose, have a crush injury to the nose itself, and then bleeding from the inside out, or you can have any type of laceration around the face.
The whistle goes, and Mike Gatzey's going to scurry off the bench.
Oh, we got a lot of blood. Take your gloves off and try to grab where it's bleeding. In this immediate moment, you probably don't know where it's coming from, and you're like, what the heck is happening? Versus somebody who can see your face.
Dallas.
Oh, so accidental. That sucks because it's not just somebody's elbow. If you take the Electron onto somebody's face, it's gonna hurt a lot. But you have a big elbow pads in hockey, so it's a big hard surface as well.
Catch up to it, but the Zingle, he can really skate.
Oh,
He got back.
is that him screaming?
Oh, no.
Yeah, he's screaming.
That's the toe of the skate caught underneath him. That's a broken ankle.
This guy definitely had an ankle fracture, needed surgery. Don't know exactly what bones, but most likely it is the two bones that make up your ankle at the top, your tibia and your fibula. You have the talus that sits where the tibia sits on top of it, and then the calcaneus.
It's just wide off the stick of Shabbat, and he can't finish it.
Oh man, oh my gosh, you see the blade to the face? Whether you're an athlete like these guys or just trying to get through your daily grind, you need the energy and focus to stay in the game. That's where Level Up by my company Life Happens comes into play here. Find Level Up at lifehappens.com or on Amazon. Oh, so a big accident, but oh wow. Look how close it is to his eye. Thank goodness he did not get it to his eye. It would have had loss of his eye potentially. As long as it's not too deep, it's not going to mess with your lacrimal duct.
Tried to clear the rebound.
Oh, you just see him go down.
High stick caught Berard.
Boy,
He's down.
this is going to be a problem.
The night I got injured, I mean, I pretty much remember everything.
Brian Berard is badly cut on a high stick by Marion Olsen.
He had a globe rupture and laceration as well as a retina detachment. Could have had a laceration around the soft tissue of the eye, which would cause some bleeding.
I knew I was in trouble. I knew it hit me right in the eye, and that's kind of where I kind of left off.
You can even tell there's a significant abnormality to his right eye. I wonder if there's any vision to that eye versus if it's just there from a structural standpoint, because it looks very much different.
I guess anxiety set in a little bit because I knew something was definitely wrong. And then when they started with the eye wash in my eye, I could kind of see everyone else's faces and stuff. And then it kind of really set in, and I knew that my eye was, pretty much open.
Say you have an isolated eyelid laceration. There's something called the tarsal plate. You need to make sure that that is perfect.
Perfect.
If it's not, it can cause an irregular border, which then can cause scarring of the cornea and make you go blind. Or your eye is always going to be dry because it doesn't allow the fluid to stay on the eye.
There's a hit by Jokinen on MacArthur. Oh boy, Sednick. Oh my goodness.
Oh my God, he's bleeding bad.
Richard Sednick is
Oh.
wide open. Oh my God.
This is a carotid artery laceration, able to hold onto the area, and you don't see a massive amount of blood dripping everywhere. Can you fix this? Yes.
Yes.
Get help.
Folks, this is ugly. Richard
Put
Sednick
pressure
is cut
directly
wide
on it.
open.
Okay. If it is a partial carotid artery, the problem with that is it's still open and still spewing blood, basically. So what do? You put direct pressure on that area. Don't put direct pressure on both sides because you need blood flow going the other way.
You know what?
Oh, it's his neck. They've got a towel on his neck. Dave Zanobi, the trainer, and they're getting him right into the dressing room.
If there's a complete tear all the way through, both ends could have kind of slingshot in both directions. We'll have bleeding and you need to get that controlled, but at least it should
slow down a little bit.
You do potentially need to put pressure over a larger area to get that to stop, and you need a vascular surgeon to have this repaired. Oh, his own teammate by accident.
Right.
Woo!
Down, and there you can see.
Oh, look at all the blood. The initial spurt of blood, because it's under pressure. And then if it stayed open and you didn't do anything, then it would be pumping with each heartbeat. If you guys enjoyed this video, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.